Hello guys, welcome to my YouTube channel Stepwise Lapro BGY. Today we will see simple case of TLH. We start with fallopian tube. We'll coagulate and cut the corneal structure first. I am starting fallopian tube followed by ovarian ligament and then round ligament. We have separated ovarian ligament. Now we'll go for round ligament. We will keep the neck on the posterior fold and then we'll go anteriorly to separate utrovesical fold. We have kept the neck and we are separating now utrovesical fold. A U-shaped utrovesical fold to separate bladder from the uterus. This surgery has been performed by two 5 mm scopes and one 10 mm camera scope. We are separating utrovesical fold from one end to another. We are separating another round ligament opposite side. Now we are coagulating and cutting right fallopian tube. As this is an unedited video, only the speed has been increased. Minor bleeding is there. Ovarian ligament is there. We have completed the anterior part. Now we'll go posteriorly. Posterior fold up to uterosacral ligament. We are stretching and cutting the uterosacral ligament. Now we'll go to opposite side as well. We have finished both side uterosacral ligament. Now we will separate the bladder from the uterus. So I will demonstrate today central separation of the bladder. We lift and cut the standing fibers. These are the bladder pillars. I am separating, cutting and pushing towards the bladder. Now we will skeletonize the uterine arteries on both the sides. As we have seen in last video, we will separate the uterine vessels beautifully on both the sides. This side I have completed. Now we will come to the another side, separating the bladder pillars on the left side. Now separating the uterine vessels, skeletonizing uterine vessels. With bipolar, we'll coagulate and cut the uterine vessels on the left side as well as on the right side. Now we will coagulating the uterine vessels on the right side as well to complete the devascularization of the uterus. Now with a bipolar shearer we'll cutting the uterine. Immediately after cutting the uterine vessels, I am going posteriorly to complete the uterosacral ligament and the pericervical ring So we get a push of cervix upwards, so we don't go more deeper on anteriorly as to avoid injury to the urinary bladder. As you can see, I have gone first posteriorly, completed the demarcation, and then came anteriorly. So we need not to go more far and far, more deeper and deeper anteriorly, so as to avoid the injury to ureter and urinary bladder as well. See, we are cutting and coagulating uterine vessels, then we'll go posteriorly to complete the uterosacral ligament, and with that demarcation we go as anterior only as we have gone posteriorly. We need not to take a stitch on cervix. With a simple Sukhadia manipulator, we are manipulating from the vaginal end. This completes pericervical ring. Now my assistant will insert a Sukhadia tube from below around the manipulator. Till that time I will separate the fallopian tube on both the side to save the time, as we are free till he inserts a tube from the vaginal end. So we are utilizing that time to separate the both fallopian tubes during inserting the tube from the vaginal end. We have separated the both fallopian tube and kept in the pouch of Douglas. Now my assistant will bring the tube. As the tube reaches here, we have completed the rest of the separation. With monopolar cautery, we'll do the colpotomy with a coagulate current only, not using cut current. We can see beautifully the white part of the tube is appeared. We are completing on both the sides colpotomy, left as well as right. As there is a uterine is nearer, I will separate with the shearer and coagulating the uterine vessel. Better we call it descending cervical artery branch. Now we are separating colpotomy on the opposite side, right side, going posteriorly. Here's the role of hand-eye coordination and the assistant vigilance. So to save the time of, we insert a fallopian tube, both fallopian tube from the POD to the tube before completing the colpotomy, so as we are not wasting the time in the OT to remove the uterus and then again separately removing the fallopian tube. So with this step we are saving more 5 minutes in our OT. We have completed the colpotomy. We are removing the uterus on the vaginal end. As my assistant catches from the video, we remove. We'll go toward endosuturing now. We have inserted our needle. This portion is bit edited. We have not cauterized after removing the uterus. We'll look for bleeding as well as methylene blue dye test after suturing, as we have no doubt in bladder separation also, but we have making habit of methylene blue dye test in each and every OT. So 211 stitch we are taking with needle holders. Here we found some difficulties with lack of assisting, just because we are using only two ports, as the patient was only normal uterus adenomyosis and the small multiple fibroids in the uterus. So we are using only two ports, so we are not getting any help from the assistant or from the right side port. We are using only left side two ports, so I am doing only the job of retracting and assisting myself only. We are completing the endosuturing, tying the final knot here, 211. We are included both the uterosacral ligaments so as to prevent the wall prolapse in the future, and the very good wall suspension is there. You can see there is a no bleeding, bloodless surgery. There is a very good advantage of laparoscopic hysterectomy that we can see on the monitor very beautifully. Practically there is a no blood loss, and patient can go home within 24 hours to 36 hours of the operation. Now we are cutting with the scissor, and we will remove the 5 mm port after wash saline wash will be given. As there is no bleeding, no need of cauterize the area. We have beautifully vault suspended with both uterosacral ligament included in the endosuturing. So patient will not having the issue of wall prolapse in the future. We will remove the 5 mm trocar under vision and 10 mm trocar. Thank you. Thank you for watching my video. Subscribe my channel for more interesting videos.